Hello and welcome to Tech Talks, the People and Planet podcast. Today I'm joined by Joe Hawayek, the CEO of Diginova. Hello, Joe. How are you?
Hello, Lee. I'm fine. Thank you very much.
Thank you so much for joining us on this episode. It's going to be a unique one, definitely, because usually we speak to founders and CEOs, as you know, on this show. Your business model is slightly different to this in that you're a strategic digital health partner. It would be good to kind of unwrap that a little bit for the listeners. Give us an overview of what you guys do and the model.
Absolutely. Thanks very much. The issue is too often founders have an excellent finger on the pulse. They have a real life problem that they've identified. They've produced a solution or a product that responds to that problem, and then taking it to market, as it were, is where the hindrance happens, and they find they can't grow or can't develop or can't get their voice across to those who should be listening. And so in a business sense, this could be somebody who's established a startup in their home geography, built up something with good result, good traction, but then has an eye on another region, another geography, like ours is the Middle East and North Africa, and then they would find it difficult coming across. Yes. Coming across, moving, expanding into another geography requires a lot of know-how and presence and access skills, and that's what we wrap around that startup and are able to help it grow. It is a business model, commercial model, helping startups find that commercialization or monetization and access of their solution.
Yeah, really interesting, because I think you hit the nail on the head there. We speak to lots of people on this show, and we were talking earlier that they've got a real life experience of the problem that they're trying to solve, and they're super switched on people with great ideas, great vision, super mission, but perhaps just don't have those contacts, that access, the local market knowledge as well, to really kickstart that.
Nobody can have everything.
Exactly.
This local market of ours here that is also lacking and missing on the insight that these founders have come up with. So it is a win-win situation. We find the demand in this market for innovative health technologies that really address a condition or a disease, help people take control of their health, help whether it's in diagnostic or diagnosis, all the way to therapeutic and management plans, and across a number of health conditions. Always they would have something that is able to be international, but for whatever reason they're still constrained within their geography, and those are the people we want to attract. These are the founders who really have thought outside of the box and all the rest of it, and have really thought outside of traditional ways to solve age-long problems using new technologies.
Sure, absolutely. So how have you got here then? What's your background? What inspired you to set up this business?
I think similar to the company is my background is technology. That's why I studied. I worked as a software developer and digital systems and all of that, high-tech data analytics and things. And that's at the heart of everything that I do. But then wrapped around it a business degree, a business experience, years of management consulting, really to recognize that it's the wrapper around the candy sometimes that takes it to market. And so working alongside finance and marketing and strategy and regulators and compliance, legal, all of the things and all of those types of services that a new company needs, in particular when it's moving to a new market.
Yeah, absolutely. And do you feel that background has helped you in terms of setting up Diginova?
Yeah, absolutely. Diginova is the company that can have its finger on the pulse of founders. And so having worked alongside these kinds of issues for many years, either on the side of, let's say, startup incubators and accelerators that attract companies to support them, or on the side of governments that similarly are looking to support small to medium enterprises, or on financial institutions and lenders and funding and investors. From all of these different angles, my experience came together to see that there are a set of critical success factors, and they're not on the product even. The product discussion around the minimum viable product and it being good enough and fits the requirement and all of that is a different story. It's only simply the wrapper that goes around that candy, and those are critical success factors that need to be there. It is true, and then I've attracted the types of people who like to work in such an environment. So we've got the clinical, medical background people who've worked in operations of hospitals, operations of telehealth providers, or remote care, or home nursing, and all of that kind of background operations clinically. Also, people who come from technology backgrounds, of course, who are able to understand either enterprise-wide solutions that a whole hospital might invest in, all the way to point of care or a B2C or a patient-led technology like an app or a wearable device and how that works. And of course, crucially, the finance equation comes in. Where are you getting the appropriate funding for you to be able to fuel the growth? Often that's an investment kind of discussion, or it could be a loan, or it could be also different ways of doing more for less money. The ability to utilize a network of almost contractors or freelancers and things instead of hiring full-time in those early days of entering into a new market.
Yeah, absolutely. And all of those things, founders just wouldn't really know unless they know. And that's where, someone like yourself.
Unless if they're a founder in a company that does exactly this. So indeed, they are a founder in often something that nobody else has thought of, which is this, let's say, health tech solution for a real life problem. And that's what they're really good at. And that's that candy. So in a way, I'd rather they didn't get distracted with some of the some of the other things, because it is a laser sharp focus that they've managed to maintain against all odds. They've gone uphill, against the tide and all of that, to be able to call themselves a founder. Themselves and their co-founders have that ability. That is unique. That is really unique, and I wouldn't want to distract from that. And that's why these support services that we offer is this vehicle that can take them to market whilst they maintain their focus on their purpose.
Absolutely. So you guys are still in your first year of business.
This year is our first really upgraded year of business. There has been a period of time, a year and a half before, of ramping up and analyzing and studying and getting ready for the market. And indeed, building up a team and building up a body of knowledge. It is this year that we have found that we're able to bring to this market what our mission and our purpose has always been: attracting these founders and the right type of skills that are needed.
So, what challenges have you faced in that time?
Well, if you just think about general health tech challenges in general, the whole sector or subsector of health technology and digital health, etc., has been hit very hard by COVID. There was a period of time during COVID. It was, COVID was seen as this CIO of the world, or the catalyst for change, and many people adopted and took up digital and online. You look at any industry, more people were buying their groceries online than ever. People moved to online education, and people looked after their health more. Telehealth companies skyrocketed and all of that. After COVID, that's all regressed almost. It's like a pendulum that swings. It swung the other way completely after COVID, where a lot of companies had over-invested in their teams, over-invested in their technologies. They kind of almost ran out of investment and found themselves having to cut down. So this general environment is one of the challenges where we feel we have to really look harder and more specifically and pick on the real success stories. Not anybody with the words health
Yes.
and tech in the same sentence is going to be the right choice. So we're having to work harder on investors and in attracting investment money. We're having to work harder with all kinds of professional services who would have normally just jumped in. So there is more due diligence, I suppose,
Yeah.
which is a good thing. It just is harder work and more challenge going on, let's say.
Hopefully, that if you do the due diligence to start with, the hard work's been done, and hopefully that bears the fruits later on without any of the hiccups that we saw after the COVID pandemic, where people did overhire, ran out of money. You only have to turn on the news on LinkedIn to learn about the latest layoffs and all that sort of stuff, which has been happening over the last 12 months. So I think that, lots of businesses within the space have been more cautious, more diligent when it comes to things like spending, whether it's on technology, whether it's on process, or whether it's on people. So hopefully that does bear fruit in the future. But what's next for you guys then? What's in the offing?
Exciting times, because we're now in a lucky and privileged position to be starting to be known and attracting the right types of skills, the right types of startups, and the right types of innovation. We can almost start to be more selective and picky of who we encourage to come to the region. With our finger on the pulse of the demands and the needs in the region, we look at, obviously, mental health is one of the major issues, and it represents itself differently in this Middle East region. The type of stigma is different. Sometimes it is gender specific, sometimes it is age specific, sometimes it looks at different parts of the region in different ways. There are different drivers of mental health issues. And so technologies that are looking to extend access to mental health support over technologies are ones that we are looking to focus on and prioritize and such. Genetics and genomics are areas that around the world are only now starting to gain understanding and traction in their use of identifying risks before they occur. And so the ability to prevent disease down to the DNA or the genome test. And those are, again, taking their own special flavor and nature in this region, because of obviously the genetic pool is a different one than than the other parts of the world. And you look at on femtech, women's health. Similarly, again, there are barriers to access, barriers preventing women to access appropriate healthcare in this region that are different to many of the other regions. So again, we're attracting the kind of femtech startups and innovation in that space. And it's not only the reproductive cycle as is traditional around the world on femtech. It is a number of diseases, from heart conditions to lungs to etc., that represent themselves differently in women. But the issue here is really the access to care. There is demographic reasons, socioeconomical reasons, digital divide reasons, where some women are underrepresented and underserved in this region. And so those are also priority areas for us.
Do you feel that that's a cultural thing to do with the region as well? Or are those things, are femtech businesses really sort of being encouraged at the moment?
They are being encouraged by many parties, but yes, it's cultural. It stems hundreds, a long time and many years.
Sure.
It is cultural at every level of society. And then, yes, there are the right kind of support. You see governments, you see accelerators. There's a number of women femtech technologies, whether led by women as far as the company or the service offering is for women. Either way, there is kind of support, but I think in some cases there's always more that can be done. As far as we're concerned, we'd like to attract these kind of skills, because the more we have in the region of appropriate insight and the right level of thinking, the more that will harbor and grow this this and develop.
Yeah, absolutely. And you're based in Dubai, aren't you? But you cover the Middle East and North Africa as well.
Yes, our aspiration is to cover all of Africa, but currently it's most of realistically has been North Africa. Myself, I'm based in Dubai, and a number of our team as well. And then we've got people based in Turkey. Turkey is another part of what we call the Middle East. It is the Gulf countries and the north of that all the way to Turkey and North Africa. And we travel a lot. Mostly Saudi Arabia is a key market, of course, with the Saudi healthcare transformation and how much is going there, not just from the central government transformation program, but also private sector, opening up of private sector participation in healthcare. And there's a lot of activity. We're there next week for one of the major events that happens. And then the neighboring Oman, Bahrain, Qatar. So we are in all of these geographies, but mostly headquartered out of Dubai. Dubai remains a hub, commercial hub for the region, and we find having a foot in the Dubai International Financial Center, the DIFC, gives us this access and being available.
Really interesting, Joe. It's all we've got time for, but I'd love to get you back on the show at some point next year. When you're a little bit further in, you're perhaps you're in your second year of full business then, and you've probably attracted more people to the region, and we can talk about who and what and how things have progressed over time. So yeah, it was really, really interesting to speak to you.
I'd love to. Absolutely, such a pleasure. Thanks so much, Lee.
Thanks, Joe. This has been Joe Hawayek, the CEO of Diginova. Thanks very much.